Welcome everybody to today's webinar. We're really fortunate to have Dr. Elisabeth Drance to share her expertise with us today. My name is Dr. Jeff Soloway. I'm the co-founder and chief training officer at MindWell-U. MindWell-U offers online and in-person trainings in mindfulness for organizations. Our core training is the 30-day mindfulness challenge, which we offer to a number of different organizations nationally across Canada and into the US. And we're thrilled to host a monthly webinar where we feature a different topic and a different expert sharing their experience in that topic. So we're really grateful to Dr. Elisabeth Drance for joining us here today. Dr. Drance is a clinical associate professor of psychiatry at University of British Columbia. She has worked in the field of geriatric psychiatry for the past 30 years. She's also become interested in the area of mindfulness. And so she has a unique perspective to share with us, both as a psychiatrist and as well as a mindfulness practitioner. So welcome, Dr. Drance. Thank you so much for joining us today.
Thanks, Jeff. Thanks for having me. And the added perspective is also of a family caregiver, of someone who's lived with a dementia. So I think it's like across the spectrum there.
Mm-hmm. Absolutely. And maybe you can, I just gave a little brief introduction. Maybe you can give us a little bit more of a background into your work as a psychiatrist and how you got into mindfulness.
Sure. Well, my interest longstanding has been working with people who have a dementia and their families. And my experience has sort of crossed the spectrum from care at home to long-term care, and specifically care for people who have what have been called responsive behaviors or challenging behaviors in part as a result of their dementia. And what I've become very interested in over the last probably 6-7 years is looking at when conversations and interactions go awry, what is actually going on, and how can we shift the conversation so it works better. And so I've had lots of great colleagues along the way nursing colleagues, and have really enjoyed kind of watching interactions that are challenging and just musing on what's happening. And so from that, I was really interested in the idea of interpersonal neurobiology, like what's happening in the brains of both people when they're together. And so I actually attended some work that Dan Siegel had presented around that. And it really started me thinking about a different way of understanding all of this. And then I decided, well, what is this mindfulness stuff? And took mindfulness-based stress reduction and mindfulness-based cognitive therapy for myself, just to really immerse myself in the practice. And, lo and behold, it really shifted my own life and my own practice. And during that time, I was caring for my mom, who struggled with Alzheimer's disease and a vascular dementia, and really learned the value for us of mindfulness in our interactions. So from there, it sort of has spiraled forward into how can we really support family members and people doing the work in either at home or in long-term care? How can we support them to make things work for them and for the person they're providing care with, that they're working with?
Okay, great. And you mentioned a couple programs there: the mindfulness-based stress reduction, mindfulness-based cognitive therapy for viewers who are tuning in. Those are kind of a core training, traditional multi-week training programs that were developed over the past 30 years and taught within more, I would say, more clinical contexts. And interesting to see how you were able to see that, take it for yourself, and then see the application and see the benefit within your own life and living with someone with dementia. So really appreciate hearing that kind of a journey. When you talk about dementia caregivers, who are you talking about?
Well, we're really talking about two major groups: family members who actually provide probably the bulk of care and support to people who are living with dementia. And also we're talking, so that could be adult children, it could be spouses, it could be friends, it could be nephews, nieces. It's quite remarkable how diverse the group of family caregivers is. And then the second group are people who do the work of providing care as part of their employment. So that could be people from home support workers through to nurses, to care aides, and then to all of us who are part of the healthcare team. And I love this sort of quote from Rosalind Carter, who says, really, there's only 4 kinds of people in the world: those who've been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So caregiving is really part of all of our experience at one point or another. Yeah.
And how have you seen, Liz, caregiving learning? How can caregivers learning mindfulness skills benefit both the caregiver and the person who you're caring for?
Well, really in two major ways. So one is the notion of self-care. We talk a lot about the importance of family members being able to care for themselves during the experience of walking this dementia journey with their family member. And that's true also for those working in the field. You really have to be able to look after yourself and know your own needs in order to care for someone else really effectively. And then also, so the self-care piece, and then the second piece is how it really helps us to create healthier interactions with people that we're helping. So that, again, that applies to whether you're working or you're providing care to somebody who is in your family.
Right, and I guess those are 2 skills really for self-care and kind of the relational piece are skills that are going to benefit everybody, both in a caregiving role and otherwise. And I'm kind of curious, this is a bit off the cuff, but you mentioned how we all kind of fit into this role as a caregiver at some point in our life. Have you seen statistics lately about, you know, the rate of people or around dementia and number of caregivers over the lifespan that we see people coping with that?
Yeah, well, I can tell you it's growing astronomically, and more, I think the healthcare system looks to family members to be able to provide a lot of the support. I don't know the actual figures in Canada, other than to say I know that there's about 500,000 people who are living with the dementia in Canada, and that number is expected, of course, to increase dramatically as our numbers of older people increase.
Mm-hmm. I can imagine that. So people out there who are listening, although sometimes it can feel very isolating, potentially, know that there's a lot of people out there in a similar situation. And I think probably one of the key messages is get out there and find some support group. And mindfulness can be a training that offers some skills as well as a group to come back to.
Yeah, I think that one of the challenges is we're slow often to make the diagnosis of a dementia, and that can be very challenging for family members. But also, once the diagnosis is made, a lot of the attention goes towards the person with the illness, when really it's essential that we say that the care of the family member is as important as the care of the person with the illness. Because if we don't look after both, we're going to end up with 2 patients instead of 1. And that's still a place where we have a lot of learning to do, and where I think mindfulness related dementia care can be really helpful. And mindfulness strategies for people can be really helpful early on, just either after the diagnosis or early on in the illness.
I know just in conversations I've had with individuals in these situations of in the early diagnosis stage, there's a real concern around trying to slow down dementia, and then there's a tipping point where it moves more towards self-care of the caregiver, where they understand, you know, it's kind of beyond a point. And you just mentioned how right at the beginning it's important to bring the self-care of the caregiver right up to the front. I wonder, do you have a perspective on that? Have you seen that to be true in your experience?
Well, I can tell you, you know, if I had not had my own mindfulness practice, I would have struggled far more than I did, caring for my mom and supporting my dad in caring for my mom. I learned a lot about the importance of slowing myself down when I spent time with her. I'm somebody who's very outgoing and quite enthusiastic, and that energy works a lot for a lot of people. But for her, she needed me to really reel myself in and be more aware of what she needed, rather than just to be myself in that setting.
Mm-hmm. And even in this moment, for everybody who's on the call right now, you know, you might have come into it and from a busy meeting or a busy day. And can we just all take a moment to take a deep breath together and to feel our whole body sitting here? Maybe you're sitting at a chair at your desk, maybe you're standing, and just taking a moment to feel your feet even on the floor, or maybe feel the connection with your seat, with your bum sitting on the chair, and feeling one breath moving into the body and a breath moving out of the body. As best you can, you know, letting go all that busyness from the day or what's to come, let it go for now, just to come into full presence with the body breathing. And as best you can, see if you can take five breaths now, just with the inhale and the exhale counting as one. Always bringing your attention back to the felt sense of the breath in the body. So we really feel the belly moving in or the chest moving out. And don't worry if the mind is busy. That's what minds do. We just come back to feeling our feet on the floor, our bum on the chair, breath in the body. And noticing now what's present for us now, and how can we respond to whatever is here and now, in our body, in our mind, our hearts, with a sense of patience, with a sense of openness, and with a sense of non-judgment. So thanks for taking 5 with us. Take 5, the core training that we teach on the 30-day mindfulness challenge. And that's a practice that we try and teach participants to drop into their everyday life and make it more of a routine. And it's not something that you need to necessarily, that was a formal practice where we kind of slowed down what we were doing, but it could also be integrated into your daily life, so it doesn't have to stop you.
Thank you, Jeff. That was great. I think that one of the things that I have actually found so helpful in working with family members and not yet staff, but certainly I do a lot of work with family caregivers, is the idea that a practice that's as focused and as relatively brief as that Take 5 practice can make a tremendous difference to people during their day when they are so busy and they're called in so many directions. And so it really does help bring people right into the present moment, which is where they need to be when we are looking after and trying to help somebody with a dementia.
Sure. And, you know, I've heard from a lot of caregivers that, you know, one of the challenges is when you're caregiving is the time. Like, time is a major stressor, because now on top of everything else that's going on, you've got additional responsibilities, and so time is of the essence even more. And so being able to learn mindfulness or integrate it into your life in a way that is practical, in a way that's going to work with your schedule, is an important consideration, because we don't necessarily have a lot of extra time. That's for sure. in today's busy world.
Yeah, and I think one of the things that's so interesting, though, is that the more we are practicing mindfulness, the more time we often find which is so counterintuitive, that even though you're spending that time taking 5, you save a lot of time. For instance, as a caregiver, whether you're working working with someone with a dementia in a facility, or you're actually working with them at home as a family member, you say, when we are present and really in the moment of care, we save a lot of time because we're dealing with a lot less of the resistance on the part of the person with the dementia who might be getting very activated by what we're doing if we're not present, if we're not really with them. So yeah, it's amazing how it actually creates time and saves you time in the long run, which is why it's so important too in the healthcare system for us to really get the message out.
Mm-hmm. Mm-hmm. It also it points to the direction of time having, there's an element of perspective in time, and we create some stories around time, and we can bring stress to that as well. So when we're in the moment, and we can let go of some of those stressors that we're bringing to this notion of time, and it does create more time. Sometimes 5 minutes in, 5 minutes of practice can create 10 minutes of clock time. So it's an important reminder for us that there aren't many ways to create more time in our lives. I know some people wish they had more hours in the day, but mindfulness actually does have a funny way of giving you more time.
Totally agree.
So we had our last webinar, one of our last webinars, talking about mindfulness and self-care. And I'm curious if you can summarize more about how mindfulness practice can support caregivers' well-being, families, and the healthcare team.
Right. Well, I wonder if you can just put on that next slide of the oxygen mask. Yeah. So this is such a classic image taken from, one of those pamphlets on the airplane, and it says, place the oxygen mask on yourself first before helping small children or others who may need your assistance. And so this is exactly why we need to practice mindfulness as caregivers, because they're actually dealing with sort of very easily triggered people. So people living with the dementia are often very easily fleeing into fight or flight because they're having trouble making sense of the environment. And so being able to help people to deal with their own stress really helps them to be able to be more present with the people they're caring for. So mindfulness, one of the things we know is that from sort of the Eastern teachings where mindfulness takes its root, mindfulness practice takes its root, is we know that, difficult things happen to all of us in one form or another. Suffering is there, but the cause of most of our actual pain is our mental evaluation of the experiences that we go through. So our thoughts and our feelings. And we can get lost in the thoughts and feelings and the stories. You mentioned stories, how we begin to tell stories about how difficult the situation is. And sometimes that just becomes reality. Or the alternative is we run away from it and we pretend it's not there. And yet then the stress comes up in our bodies. So mindfulness really helps us to sort of recognize when we are stepping off into unhealthy thought trains, when we're getting on the thought trains. One of the beautiful analogies that Take 5 and the Mindfulness Challenge uses is we can jump on a train that takes us in a direction that's really not that helpful, or we can feel overwhelmed by our emotions, and that takes us towards anxiety or towards actually feeling depressed. But mindfulness really helps us to sort of not to recognize those thoughts and feelings as they're arising and just watching them rather than kind of getting glued to them. And that really helps us sort of let them pass more quickly. Mindfulness helps us avoid unhealthy distractions. So what we often do in running away is we, run to our iPhone, or we, run to the television, or we run to the liquor store, or, we use substances to try and numb ourselves away from the experience. And mindfulness really, sort of helps us to avoid and bring ourselves back from that. It also really helps us to accept that this is the way it is. A lot of our suffering comes because we wish it was the way it used to be, or we're really worried about what's going to happen, but then we're not actually present for what's really going on. So mindfulness really helps us to kind of accept the situation and see it for what it is. And then we really also develop the understanding that there's really the only constant in life is change. So that whole notion of impermanence becomes actually something that's really helpful to recognize. Family members will tell us that, the only thing constant in this dementia journey is constant change. And you just think you've got things sorted, and then something else pops its head up. And that is the way all of our lives are, actually. Change is absolutely part of it. And so being able to recognize that gives us often some perspective and ability to recognize that we're not alone in that. And it sort of
pause you there.
Sorry, go ahead.
I just want to pause you there, because I think it's a really important point that you're making around acceptance, and it could be a very difficult one as well, especially for caregivers, coming to accept the new reality of a loved one in their life. Is there anything further you've seen of people, within yourself or populations you've been working with, going through this process of acceptance? Or, it sounds, without making it too theoretical, because it's on the level of theory, it's not too helpful. It's more the experience of that.
Well, Jeff, you raised the issue earlier about the importance of sharing the experience with other people who are also going through it, and providing that experiences, that support and sharing with other people is done in a constructive way, where there is hope in terms of being able to learn how to approach this experience with sort of an equanimity, like, if you like. It's being able to be curious about what is this experience for me, and what can I learn from it. I mean, I have to say, some of my greatest personal growth came through the very difficult times that I had in and shared with my family in caring for my mom. But it doesn't, sometimes being with other people, if all we do is just kind of bring forth all the terrible things that are going on, it can become just a calamity festival, and then it's not helpful. So the question is, that's one of the reasons why, being part of a mindfulness group, or learning it online with people, or, one of the best parts about when I went through the Take 5 program, the best part was being a buddy with somebody else. And I was able to be a buddy with a friend of mine, and we shared the experience of what we were learning and taking away from learning these mindfulness skills. And I think that that's such a helpful part of the process, is when you can share it, but also share it with some kind of hope, as opposed to just it all being dark and black.
Mm-hmm. Thanks. And what Dr. Drance is referring to is on the 30-day mindfulness challenge. When you register, you get to invite a buddy for free, and you and your buddy will go through the whole training together. And the 30-day mindfulness challenge is an online training made available through MindWell-U, and it's an introduction to mindfulness with videos, and then we're teaching you this Take 5, and we also have some reflections that you're able to contemplate as you go through the training, and it's those reflections that you're sharing with your buddy. And the reason we added in that buddy piece is because we see it as like your workout buddy. It's just like you're more likely to go to the gym. if you've got a workout buddy, well, you're more likely to do your mental exercise if you have a mental workout buddy. And in this context, I think what you're pointing to is the value of having a support person. And I wonder, would a person with dementia, how would you see them interacting with learning mindfulness? Have you?
Yeah, I don't have, there's very actual little that's written in the literature around people with early dementia learning mindfulness, but I have this vision in my head that I think at some point would really like to try and look at, which is, wouldn't it be amazing if part of the diagnosis is an opportunity to learn with your spouse or your child a skill together, such as mindfulness, and to see if over the course of the illness, it actually could keep you connected in a different way, because we all breathe. Like, we all breathe, and we can all notice our breath. And even when we're not necessarily conscious about it, we find when we breathe and someone's with us, our breath often coordinates. And so I'm really fascinated with the idea of what kind of change would it make in the relationships over time if we had dyads or pairs practicing together. And then even if the person with the illness was eventually not able to actually follow up on the formal practice, the caregiver would be following up and be able to kind of use that in their interactions with the person. So I think it's a really fabulous question, and something that I'd really love to look at in the future.
Right, because we do know that mindfulness, the mindfulness practice impacts the stress response and areas of the limbic system and like the hypothalamus around memory and learning, right? That's the center around memory and learning. And around dementia, that's one of the areas that starts to get, affected. So, I haven't seen direct relationships, but I've seen in some initial studies pointing to some relationships to at least memory and learning and working with dementia patients.
Right. And that that makes such good sense, because the chronic stress response, of course, causes the secretion of cortisol and kind of the unregulated secretion of the hormone called cortisol. And that actually has been shown to eat away at the hippocampus. And it's true for me as a caregiver. If my stress level is really high, it's also eating away at my hippocampus. So that's why dementia caregivers, our family members, are often at very high risk themselves of eventually developing a dementia if they don't deal with their own stress, which is why this is much more than a nice to have and really quite an imperative, and why mindfulness offers such a really helpful way of reducing that stress response.
I know you wanted to speak a little bit further about the stress response and even introduce a model of that. Maybe it's a good time now that we're on the topic.
Sure. So one of the things that I learned from Dan Siegel was this hand model of the brain. So if you can imagine that my hand is actually going to become the brain, and this part of my brain, my arm, is the spinal cord, bringing impulses into the brain. And this part of my, the palm of my hand is the brain stem. And the brain stem controls our heart rate and our breathing rate. And it also, it's sort of the site of the fight or flight response, which happens when we are terrified. We either fight or we flee or we freeze. And that's where that kind of, that fight or flight center lives. Then on top of it, I should have two thumbs, but I only have one, is the limbic area that you described. And part of the limbic area is a little almond-shaped organ called the amygdala, or not organ, but part of the brain. And the amygdala is the warning bell. And it just rings whenever it feels that there's danger in the environment. And then over top of that, you have the cortex, which is, so if this is now oriented, so my fingernails are sitting right behind my forehead, that's the prefrontal cortex. And this is the higher part of the brain that controls language, controls vision, but it's this part, the frontal part, we're really interested in when we're talking about mindful interactions. So as you can see, that little warning bell is in contact with the fight or flight center. And it's also in contact with my prefrontal cortex, which is the sort of the highest area of organizing our thinking. It plans, it assesses, it judges, it appreciates. And when we're under stress, it gets very tenuous and it doesn't work that well. So, you know, when the more stressed we are, the more likely when things come in that seem uncomfortable, the amygdala will ring. And normally what happens is that prefrontal cortex calms everything down and says, we're okay. It's nothing really to worry about if it really isn't. So two things happen. If you have a dementia, that part of your brain is often really weakened. And so the alarm bell will ring and it has nowhere to go but directly into that fight or flight response area. And so for the person with a dementia, they, what we call flip their lid, the lid being the prefrontal kind of controls very quickly if they feel anxious. And then we're into fight or flight. So that's the kind of the faulty wiring of a dementia brain. Then me, if I'm the caregiver and I'm stressed, I also, my prefrontal cortex is really, it's much more tenuous in its response. And I too, when I'm angry or frustrated, I can flip my lid and go right into fight or flight. So really what I've learned over time is that our goal in dementia care, and this is true whether you're working in healthcare or you're a family member, the goal in any interaction is to keep both of us out of fight or flight and to keep both of us from flipping our lid, okay? So mindfulness actually really helps us as caregivers. I mean, I'm the one with the functioning brain, so I'm the one who actually can develop new skills and new behaviors. And so I through sort of mindfulness, I can stay out of what we call the amygdala hijack. So I think you have that picture there, Jeff. When I flip my lid, I'm likely to have a strong and sudden emotional reaction. I'm going to say or do something insensitive, hurtful, or opposite to my intention. The after effect lingers and I don't recover easily. And it really taints our behavior, mood, and decisions beyond the time of the interaction. And so that amygdala hijack can happen to the person with dementia, or it can happen to me as a caregiver. And when it happens to me as a caregiver, I can usually precipitate it in the person with the dementia. So the stronger my prefrontal cortex, the stronger my integration of all the parts of my brain is, and that's partly what happens through mindfulness training, the less likely I am to go into amygdala hijack and really create a difficult scenario for both the person I'm supporting and for myself.
Wonderful. I want to welcome everybody who's watching the webinar as well now to chime in with any questions or comments that you might have. That was a really great overview of the stress response and this nice model by Dan Siegel about learning about the brain. Really helpful. It's a kind of a core teaching. So if you're out there listening, if you have a specific question, this is a good time to put it out there, and we'll be able to ask Dr. Drance her perspective on it as well. Perhaps it's also a good time, Liz, to just zoom back a little bit about what is mindfulness, and give us a little bit of context about mindfulness, how it's being defined.
Right. Well, Jon Kabat-Zinn, who's one of the sort of pioneers of mindfulness in the West, particularly with clinical populations. He has some really great definitions of mindfulness, and cultivating mindfulness is really about training the mind to develop a greater awareness of the present moment, which means right now. And that includes how I'm feeling physically, what thoughts are going through my head, what emotions I might be having. And mindfulness is about observing all of that without judging one's self or one's experience. And so it's actually sounds pretty simple because it's really just about noticing what's going on in the here and now. But the hardest challenge is without judgment. So without just acknowledging or just being able to connect with whatever is present. Because as soon as we get into judgments, we're already down a thought path that often doesn't serve us well. So so mindfulness in a nutshell is like, what do they say? It's simple, but it's not easy. And I love that description of mindfulness. It sounds like it should be pretty straightforward, and yet if you try and do it, you'll find it's pretty tricky. Just as Jeff said, you'll find that your head goes to all different places, and that's just what the mind does. The mind sort of secretes thoughts like saliva from a salivary gland. So we can't stop it, and we don't want to stop it, but we do want to just be able to observe it more than getting lost in it.
Right. Simple in the sense of there's not a lot to do. The instructions of paying attention in the present moment is relatively simple. It's like, are you still here watching this video, or are you on another browser? Are you thinking about something that's coming up later?
Mm-hmm.
And so the intention was to watch the webinar, but then the mind drifts. It wanders away, and it opens other windows. Very quickly it wanders. So the practice is not about shaming or judging ourselves if the mind wanders, or you've got like 17 windows open on your screen right now. The practice is about, can you close those windows and come back to this webinar and just bring our focus back, and do that with a kind awareness to yourself, without judgment, with a sense of patience and openness for yourself. And that practice, that coming back over and over again into the present moment, is literally training our brains. It's literally exercising neural circuits in our brain and making them stronger so that we get better at that. So we're like exercising our mindfulness muscles, so to speak. And we do get better at that. So the mind is still going to wander, but we're going to notice it quicker, and we're going to be able to come back faster.
So your analogy of watching this webinar and you drifting off to 17 browsers is like the analogy for a caregiver who's coming into the room. And let's take the example of a care aide, for instance. They come into the room, their mind may be on the previous interaction that they just had with the person whose care they were helping, or a difficult interaction they had with a coworker, or it might be worrying about what's going to happen when they get home because they have things to do. And if they don't come out of those two extremes and into the room with the person with dementia that they're helping, they're not going to be able to be available to read the cues of the other person, or to read their own cues as to how they're doing. Because if I just sort of step into a conversation or a care interaction with someone with a dementia as if it's a task to just get done, I'm going to trigger that fight or flight response very quickly. So I like to think of, that as caregivers, we're either day breakers or day makers. And if we're a day maker, if we can really be present and really connect with the person rather than correct whatever it is that they're misunderstanding. So it's all about relationship over task. There's no point in getting the task done if you're traumatizing the individual in the process, or traumatizing yourself, because it becomes a stronger and stronger conditioned response.
And so there's so much, what I'm hearing you talk about is so much of this self-regulation and awareness of self, so that we can be more responsive versus reactive. And when we're busy, which we often are in our daily life, and we're stressed, which we can often be, our habitual response, our automatic response, is to be reactive, is to blurt out an automatic response, an automatic behavior that often is unhelpful in that care relationship.
Exactly. So that's when we're struggling with amygdala hijack, right? It's just we react rather than choosing a response. And mindfulness practice really helps us to, as you say, to build that muscle for pausing. And there's a lovely quote, I think, Jeff, that if you can show it.
Okay.
So it says practice before, or pause before judging, pause before assuming, pause before accusing, Pause whenever you're about to react harshly, and you'll avoid doing and saying things you'll later regret. And mindfulness really strengthens the pause. I like to call it the sacred pause in caregiving, because it's the time where if you just wait and watch and bring yourself into the present moment with the person you're looking after, it will be really, it will change the nature of the interaction for the better.
And I know we wanted to touch on a couple further practices that might be helpful. We did discuss Take 5, which is the core practice on the 30-day mindfulness challenge. And I know you've gone through the challenge, Liz, and you've had experience with it. Maybe there's some perspective you can bring to the Take 5 practice versus other practices you've seen.
Well, I think one of the things I love most about Take 5 is that Jeff took us through it. It's really focused, and it really helps with present moment awareness. So, and it's portable. You don't have to close your eyes. You don't actually, have to sit on a cushion. You can do it right, where you are. And the more you do it during the day, of course, the more you build your mindfulness muscle. So I love it for that reason, that it's a great introduction to mindfulness for all of us. So you can start with sort of no experience, and by the end of 30 days, really have a really great understanding of what mindfulness is. And the other part I love about Take 5 is in the 30-day challenge is there are short videos every day. And some of them are, they're all great, but some of them are just like, they catch you. And they're short and they're pithy. We talked about the fact that people don't often feel like they have a lot of time to commit to something. And this is a great way to start, to start your mindfulness commitment and see what changes in 30 days. It's quite remarkable. So I like it for that, as well as for the fact that you can do it with a buddy. And as you said, it's like your gym buddy. It's the person who kind of makes sure you get there, and you have interesting conversations as a result. Yeah.
We've also had, it's interesting because one of the distinctions of the challenge is we're not teaching like a formal meditation practice. We're not asking you to sit on a cushion for 20 to 45 minutes, which often is a practice in a multi-week mindfulness-based training. It's a bit of a different approach as an introduction. And we've actually had long-term meditation practitioners come take the challenge and talk about the value that they found about integrating mindfulness into their daily life. So they've become good at meditation, quote unquote. So they're good at sitting on the cushion, and that really helps you lower your stress response in that moment, and set you up for the day. But then once you start going throughout the day, you can become very mindless and forget how to integrate this practice of presence into your everyday interactions. So interesting to see how it can work for both beginners, but then also experienced practitioners as well.
Well, I think there's no point being really great at sitting on a cushion for 30 to 45 minutes if it doesn't translate into the quality of your day-to-day life. And so we talk about the informal practices of mindfulness, sort of, again, anything that brings you back into this present moment and out of that wonderful brain of ours, sort of, our thinking mind, and back into the present experienced activity. So it could be washing the dishes, could be brushing your teeth, could be it could be going for a walk. But all these things we tend to do with a divided mind, and really mindfulness is about bringing us into this moment.
Right, and I appreciate the brain perspective, because I think it's also part of our evolution as a human species. And you talked about the flipping the lid and the inner brain and that model. And now what we're seeing is, and you also talked about the prefrontal cortex, and that's more of the later parts of brain development. And those are the parts of the brain that make us uniquely human. And we're still learning how to use our brain. And I think what's exciting about mindfulness is it's this new way of learning to use our brain and to navigate some of those more inner parts, core parts of the brain. We've got a question here from somebody from the audience that I wanted to bring to your attention here, Liz. the question is, you mentioned that the key to dementia care is keeping both dementia patient and caregiver out of fight or flight. Is the main way of keeping the dementia patient out of fight or flight about regulating your own response as caregiver, or are there additional strategies as well?
Well, I think the additional strategies, in part, it is about regulating my my level of emotion, but it's also about being calm enough and engaged enough to read the energy of the other individual. So if I'm helping somebody with a dementia get dressed, if I'm thinking about what just happened or what's going to happen, I'm going to miss the fact that he or she is telling me through changes in their body tone or in their facial expression that their amygdala is starting to ring. And if I miss that and just keep moving with the task, then I'm going to really precipitate that flipping the lid. And then I'm going to see fight or flight behavior, which may be directed unwittingly at me. And then who do we just say has the problem? It's the person with the dementia, and they have a brain that's not working well. But what we need is to be calm ourselves, to be focused in on how they're doing as the interaction unfolds, and to really focus on connecting through relationship rather than just getting some task done. And that's a dilemma for people who work in long-term care or hospitals or home support agencies where they have a limited time. But as I like to say, you spend a lot more time dealing with the fact someone has moved into fight or flight, or they've hit you, or they've sworn at you. What happens afterwards is probably 15, 20 minutes of debriefing and figuring out what to do, when the answer may, and this isn't in all cases, but it may have been in the room. The answer might have been in the room. And if we're aware of that, we might be able to read the situations early.
And are there any additional strategies that you've come across that you've seen helpful with, I think, with dementia patients, like for reducing their stress?
Right. So in keeping with what I just mentioned, there's a practice that we do right in the moment, which is called the stop practice. And it's the idea is that without judgment, you stop what you're doing. So it's as soon as you see things changing, so you might see the person start to tense their muscles or frown, or you stop what you're doing. And you take a few deep breaths yourself and really pay attention to each of those breaths, like just as Jeff led us with the take 5. And then you just observe what are you noticing in your own body? What are you noticing in your emotions? And what are you noticing in your thoughts? And then you proceed in the interaction by asking the question, okay, so what's the most important to pay attention to right now? So you look at the person and you see, aha, I think I moved too quickly. I perhaps didn't give as much explanation as they needed. I perhaps was talking too much. So in reflecting on what just happened, you can then make a plan as to how to move forward. And it may be you just leave the room if the person is really distressed, and you come back later, or you come back in a few minutes, and it will be a different experience. So the stop practice just really creates, again, that formal pause and allows you to decide how to proceed safely and perhaps enjoyably.
For both the caregiver as well as the person with dementia?
Well, I think, yeah, so you're observing both your own responses and also observing the response of the person you're interacting with. So if you just look at yourself, you'll miss a lot of the information. But it's stopping and observing both.
Right. I guess what I was reading in the question is, is that a strategy that the caregiver can actually teach someone else, like the person they're caregiving for? And are there strategies we talked about it a little bit before about teaching mindfulness to the person with dementia themselves.
Right. And sometimes colleagues of mine informally have said, I just stop and I just sit on the bed and we breathe together, right? I just breathe slowly, and it seems like our breath becomes synchronous, and then we're at a different sort of, our energy is different, and then we can proceed. So it may not be purposeful, but it may be, it may be just the resonance of the slowing down and breathing, that they join you in that.
Right. Interesting. Thank you. There was one other practice that I know you wanted to share around compassion, and
Right.
we can talk about compassion a little bit here as we start to wind up.
Sure. One of the things that is often really a challenge for us is when things don't go well in an interaction, or when they don't go well in life in general, we often beat ourselves up. That's sort of, a lot of us go to that very quickly. And so this exercise developed by Kristen Neff, called the self-compassion break, is really just 3 steps. And so it's really about stepping away from the judgments about how it didn't go well and you should have done better, and actually just recognizing that you're struggling in this moment. So being able to say to yourself, this is hard, or man, I'm having a hard time, or this is tough. And then secondly, recognizing you aren't alone, because that it's that shared humanity piece that you were talking about earlier, Jeff, that, we aren't alone in this caregiving experience right now, all across Vancouver, or all across, the globe. Other caregivers are struggling just like me, and they, just like me, they're really wanting things to go well, and it just didn't in that moment. And then applying self-kindness liberally. So just being able to say to yourself, wow, and I hold myself with kindness rather than beat myself up. May I really be kind to myself, or may I give myself the compassion that I need for this moment, so that it really helps me move forward and not get lost in how things didn't go well, because there's no way that they can go well 100% of the time. They can, they will go whatever way they're going to go. We do our very best. And sometimes I'm going to flip my lid. And afterwards, I need to be able to have something that I can say, wow, you're really struggling right now. And even that hand over the heart, or the hand on the face, whatever feels comforting to you as part of this exercise, really helps people to, as they say, to move on, to step back into the ring when you need to.
Mm-hmm. Well, that's an important message to share and get across. And we're coming up to the top of the hour here, so I'm gonna, if anybody has any final questions or comments they wanted to put out, now is a good time to share that in the chat. And I just I'll come back to you, Liz, in just a moment or so with any final closing comments that you'd like to make. I'd like to just remind our guests, our viewers, that a couple things. One is that we're going to be sending you a link to today's webinar. We'll share with you a recording where you're going to be able to pass that on or watch it again. There will also be a web page with a lot of the resources that we showed today that will be on the web page, as well as a link to the 30-day mindfulness challenge. I believe there's also a link in the chat window right now. So if you'd like to try that, it's online training that you can sign up for. And we have a training starting next Monday. So you can get started with that, and it only takes about 5 to 10 minutes a day, and might even be something you want to use, invite a buddy and create a community with. So that's available as a resource for you immediately. I also wanted to let you know that we've got another webinar coming up in a couple weeks' time, where the topic is going to be mental health and mindfulness across the adult lifespan. And we're going to be, we've got a special guest, Dr. Mackenzie. Dr. Mackenzie is a clinical psychologist and professor and director of the clinical training Department of Psychology at the University of Manitoba. He was also a mentor to me at University of Toronto when I was doing my undergraduate work. So I'm really looking forward to that upcoming webinar. He's in a similar type of conversation. His lab focuses around mindfulness, mental health, and aging. So an expert in the field, I know that there will be some continued conversation within this, but then also some distinction. So really welcome you all to sign up for that webinar coming up, and that will be on the link we send around tomorrow. We're always grateful to you, the audience who signs up and shares their perspectives and joins us. So thank you for joining us today. And most of all, really appreciative of Dr. Elisabeth Drance for joining us and sharing her time, expertise, and wisdom in this field. And again, really unique to have somebody with the perspective of a psychiatrist as well as a mindfulness practitioner and doing her own training in this area. So we're really, it's a very, very amazing perspective to get. Dr. Drance, I'll give you the final word here. What would you like to leave our viewers with?
Well, I think just to say that, no one chooses to have a family member with a dementia. No one chooses this journey, and everybody I know says, I didn't sign up for this. And I said it myself. And the road can be really a difficult one, but it can sure be made easier or more harmonious through mindfulness practice. Just to summarize, sort of by accepting the situation for what it is, recognizing deeply the importance of caring for ourselves, because we can't do the work if we're not supporting ourselves, and just focusing on the now moments, and being in the moment. And mindfulness helps us do that and do it better, and supporting our own emotional regulation that way, and building compassion for ourselves and for the person we're looking after, and just reducing anxiety and depression, which is so prevalent in the caregiving community. So it also, just finally, to sort of say that mindfulness really helps us connect with the wise caregiver. That is part of all of us, and really helps pay attention to that wisdom more than if we're in reactive mode. So I wholeheartedly encourage everybody to dig into mindfulness as a really powerful tool.
Thank you so much, Liz. Really appreciate your time. Thank you, everybody, for tuning in, and look forward to seeing you in future webinars. Have a great day.
Bye-bye.